7:05 on CJAD. Welcome to today's Entrepreneur, presented by Fuller Landau, a program about the entrepreneurial spirit that drives Quebec business. My name is Dan Delmar, along with Fuller Landau's Josh Miller. How are you, Josh?
Excellent, thank you.
Great. And today we're talking about a growing industry, and that is healthcare. Danielle Polak and Daniel Marks join us from Equinoxe LifeCare. Danielle and Daniel, welcome.
Hello.
And of course
too
we
many
have
Dans
Dan
in the room.
Delmar. There's
Yeah.
three Dans, no waiting.
We'll try to keep everything straight here, but let's begin with Danielle and Daniel, and ask you first, what is Equinoxe LifeCare?
Equinoxe LifeCare is a company that provides a variety of different healthcare services, patient-centered on a case management model, which means that we meet people where they're at. We work with them in terms of their needs. And it came out of many, many years ago. I was teaching in a gerontology program, and I realized there was a real lack of personal and personalized services in healthcare in Montreal. There were the public services and there were some private services, but people had very little support at home that was directly tailored to them. And at the time I was quite involved in palliative care. And the philosophy of palliative care is providing comfort, and comfort means personal services.
So when you say personal services, Danny, kind of what type of services would it be? Like exactly is it corporate? Is it personal? Is it, can anybody kind of subscribe?
Anybody can subscribe. Right now, some of our services are paid directly by the CLSCs, especially in comfort care and palliative care. But essentially, we try to match people with, assess people's needs and provide the services that they require. So some people would require personal care, hands-on care. Some people need transportation.
So there are services like post-operative care. So if someone has a hip surgery, we can provide a nurse or a physiotherapist to help them rehabilitate. There are services like Alzheimer's care or chronic disease management, and then all the way to palliative care. And in addition to that, we have what's called a nurse triage service, which is a call center that has healthcare professionals and nurses that can answer health inquiries from employee assistance programs. And then there's an element of technology that we infuse in both areas of the business to increase efficiency, but also make the experience for the patient better and make the experience for the healthcare provider better as well.
It sounds like there's really a wide variety of services, but at the beginning, at the outset, it probably wasn't everything. So Danielle, Danny.
Yeah, Danny.
Danny, perfect. We got Danny,
yeah.
Daniel, and Dan. Only one Josh, thank goodness. So right at the beginning, because you touched on it briefly, how or why you got into this.
Right.
Kind of, maybe you can give us a little bit of that brief history and, who you were working with and how you kind of got into this business.
Well, it started very slowly, as most businesses do. I teamed up with a nurse, Maureen Fitzgerald, and we were both very interested in providing this type of personalized palliative care. And when you start any business, it takes a long time to be known and a long time to really get going. And we worked on trying to provide these personalized services. And unfortunately, for a year, we didn't make any money. So Maureen moved on and I stayed and tried to develop. It was very hard to develop organically at that point. And I was very lucky. I had two very wonderful friends who backed me when I bought a small agency. It was a healthcare agency run by a nurse who was retiring. And I didn't know what I was getting into, as often happens when you go into a new business. So it was an agency that had about 40 personal care workers. And we moved in, and I tried to introduce this case management model.
Was the process in buying that agency difficult or time-consuming, or I'm sure it was a big learning experience?
It was a very big learning experience. Actually, the owner said to me that she would stay on for a year because she felt it would take me a year to really understand. And after 3 weeks, she came to me and she said, "You know what, I'm out of here." You run it the
not
way you want.
not exactly part of the deal that you were subscribing
No, she was
to.
very, very nice, but it was her baby, and she saw somebody coming in, taking over, and introducing new ideas, and I think it was just very difficult for her. So in buying a new business, not only is there a long learning curve, but you have to be sensitive to what's been there before and the person who's been there before.
There was an instant change of management and ownership.
Yes.
Was it difficult to gain the respect of the employees there at the time?
Yes.
How did you overcome that?
It was difficult. In fact, one person had been a secretary there, and she stayed for about 6 months and came to me and she said, "You know what, I just don't like the way you run this company." And she left. But having said that, the people that I employed then are still with me today. One is retired, but the rest of them are with me today. So it's a pretty good track record, I think.
The actual purchase of the business.
Yes.
That, I'm kind of interested in, and I know a lot of our listeners, the entrepreneurs that don't start from scratch, but that want, found this business and somebody's going to move on and buy it. Can you maybe give us a little bit of insight in, with how was it from a legal standpoint? Were there a lot of little tricks and pitfalls that you kind of had to get through? Did you rely a lot on the professionals around you? Did you just make the deal yourself with her? Maybe elaborate.
I was very lucky. She was a very nice person. I'd actually worked with her. I'm a social worker, and I had used her agency to provide some of the personal care that we needed. And so she was very easy. She knew what she wanted to get. There was no bargaining. She said, "This is what I need." And I said, "Okay." And I, as I said, I had some backing. But the contract was very simple. It was very straightforward. I'm a believer in simple contracts. I know that my son always says the devil is in the details. But it was a very amicable changeover. So legally, it was not difficult.
And when you took over, did you have kind of your own business plan in place to where you wanted to go next?
I didn't have a business plan. I had this theory that people needed to get personalized service, and the only way to get it would be this case management model, where every client becomes it's sort of client-centered in the sense that every client becomes a project with a manager who would see to it that all the services are provided.
As you look back, do you think a more formal thought process would have been better? Or you think, what, you achieved, your heart and soul were in it, you knew the industry, and that was enough?
Josh really loves business plans, by the way.
I can tell.
I just, some people, stick their nails and phone right into it and stick their teeth into it, and others just, I'm a gut person and just.
I'm a gut person. I didn't have a business plan. I had a vision, and I guess I thought that the vision was the plan. And I remember when somebody asked me to write an executive summary. I wrote what my vision was, and they said, "Well, okay, but where's the plan?" That was the plan. But I learned over years, over time, that one had to have a plan. But you have to grow into something, and you have to really feel it. That's what I felt. I felt, I had to be in it, get my hands. I don't want to say dirty, but get really involved. And then when you do get into it, you have a much better understanding. And then you can make a plan. And having said, sorry.
No, go ahead.
And having said that, you make a plan and then you change it 100 times.
Danielle Polak and Danielle Martz joining us this evening on Today's Entrepreneur from Equinoxe LifeCare. Inspiring stories from outstanding business people. Welcome back to Today's Entrepreneur with Dan Delmar and Josh Miller. Our guests this evening, Danny Polak and Danielle Martz of Equinoxe LifeCare.
And we're talking about, and you were mentioning your service earlier about being as much as possible to everybody. Now, people don't come to you. You go out to the people, correct?
Right. Well,
so you really need a lot of support, a big team to make sure you go out and reach as many people as possible.
Well, the people who actually reach out are the people who are the managers, who go to visit people in their homes and do the assessment. But then we have our own caregivers. They're all our own employees. and they come to us usually with a certification already as a nurse's aide or a nurse licensed practical nurse or registered nurse, and then we do our own training, and we feel that's very important.
Yeah, training must be huge. I mean, you are providing a specific service. You have your own vision, as you stated earlier. So, does each employee go through training regardless of their certification?
Yes. We try very hard, and we're just really now finalizing new plans for training. We've had some funding from Emploi Quebec over the years, and we've been able to really reach people, training in things that they have learned, but also bringing to them our values and our mission statement so they understand really what the company represents when they go out into the homes, because it's not only bedside care, nursing 101, it's really the TLC, the way that we deal with people, and they have, especially, we have a lot of people with degenerative diseases, Alzheimer's and Parkinson's, where there are really mood issues, depression issues, anxiety issues, and this is what we deal with all the time. It's really important to recognize people's pain.
And what advice do you give to your workers in terms of dealing with a population or a clientele base that is vulnerable than other demographics?
Well, just that's why we do our extra training, because it requires a lot of sensitivity. And the other thing that's really difficult is that even though they're part of a team, we're a team in the office and we're always there for them. Our coordinators are always on the phone talking to clients and talking to caregivers. When they're with a patient or a client, they're alone. They're alone at home, so it's a lot of, it's a judgment call sometimes. They're dealing with difficult situations, and they're going to have to make decisions on the spot. Sometimes we have very aggressive patients. We have people who are very, very ill, and it's not an easy job. And I'm telling you, they are wonderful. We have very, very few people who don't come through and really perform well.
At the same time, it's an interesting exercise to see how to translate those skills to a healthier population. So in our nurse triage service and in the service that we provide to corporations, a lot of the same healthcare skills and people skills are employed, but to a completely different population, different demographic. So it's an interesting exercise to translate the training from one to the other, and also to see how that type of care is provided at a distance. So in that business model, people reach out to us as opposed to us going to them. They'll call us on the phone, or they'll reach us through a piece of technology that's in their home or is on their mobile phone. And so it's an interesting exercise to see how to scale that type of a skill set using technology and using the plain old telephone.
Yeah, so human resource is your biggest expense, but your biggest asset. And when we come back from the break, we'll explore it a little further.
Today's Entrepreneur on CJED 800 with Danny Pollock and Danielle Martz of Equinoxe LifeCare. We're talking about healthcare, more specifically Josh Healthcare that goes into your home with Danny Pollock and Danielle Martz of Equinoxe LifeCare.
And we were, of course, talking about human resources, which, as we said earlier, your perhaps biggest expense, but also your biggest asset. You started, Danny, you mentioned you started around 40 people when you bought the business. How many are you today?
We're about, at least 200.
How did you manage the growth in numbers? What did you do that's a little different? What did you learn from that? If there's anything you would do differently?
Well, it's a constant. What I learned was you're recruiting and hiring constantly, and you're maintaining a relationship with the people as much as possible. So we do have somebody who does recruiting and hiring, and as I say, we do the training, and then our coordinators are the people who actually schedule the services and talk to the clients every day and talk to the caregivers, and it's really building those relationships.
I guess you have to create some sort of formality to the training, the checks. I presume each employee, when they get hired...
Well, that's right. There's a background check. There are reference checks. We also make sure that their citizenship papers are in order, that they have CPR. They can't go into homes without CPR. And that they have the basic training that we need. And also that they're the personalities. Sometimes you've got to go with your gut. We have our own management system. We designed our own management system. which has a matching part where
Algorithm.
we can. Sorry.
Algorithm.
Thank you. And so we can try to match up caregivers with our clients in terms of their skills, but also their personalities.
So you're trying to create a process. What you used to do based on feel and gut, you now have, and as much as you want to try and pass down that knowledge to your various coordinators, it's not always so evident. So I guess the processes that you've had to build over the last short while have been necessary.
Well, that was the learning curve, and really our management program, which we have one IT consultant. He really designed it with me, and I think it's taken 15 years to get to the point we are today, because you keep realizing that you need to add different characteristics and different pieces of information that are important.
It's very interesting and seems like a very sophisticated system. So you input adjectives, for example, of caregivers, and you match that up with the adjectives that you input from your patients?
Absolutely.
Wow, okay.
So it's skills, it's education, it's their experience. We know exactly how many hours people have spent with in certain types of cases. So, if somebody is doing post-operative work, we make sure that they have the experience and they've done as much as possible in that area.
The processes that you've had to put in place, I mean, is this something that you really did in a more recent time frame as you grew greatly, or did you realize from the get-go, you know what, I'm buying this agency, I've got to throw in some formality, some standardization?
Well, I had to. It was all pen and paper, pencil and paper. They had a dot matrix printer, and it printed up very, very slowly, and so our IT consultant, who was a friend of mine, came to me and he said, let's do it on an Access database, which we did, and we built it very slowly, but I think, it's very robust now.
And it sounds like there's so much work and effort put into it, but there's so many other areas that we're going to talk about. This technology you keep bringing up, we've got to figure out where that's going. Certainly with healthcare, it's a major issue.
Marketing and more coming up with Danny Pollock and Daniel Martz of Equinoxe LifeCare on Today's Entrepreneur. 7:35. Welcome back to Today's Entrepreneur, a program about the entrepreneurial spirit that drives Quebec business. My name is Dan Delmar, along with Josh Miller of Fuller Landau, and our guests this evening, Danny Pollock and Daniel Martz of Equinoxe LifeCare. So we're talking about healthcare, Josh, and healthcare that goes into your home.
And not only that, but it's a business, and there's entrepreneurs here, and entrepreneurs don't always like to let go. And they don't always know when best to let go. However, they do usually have it somewhere in the back of their mind. So I guess the question I have for you, Danny, is being in this business now for good 15 years, do you have a succession plan?
Well, I do, because I realize that even though I feel I have the energy and the interest, I need to bring in young blood, young energy. And that's one of the reasons that Daniel's with me now. And the succession plan is actually to hand over to younger people.
And is she good at handing things over, Daniel?
She's
There, put him on the spot. How's that?
exemplary.
You would say no different. But it's actually very interesting to hear you say that there is a realization that at some point, if you want what you've built to continue, succeed, grow, and not start slowing down, you can't do everything forever.
No.
Was there a tipping point where you realized that was the case?
Yes. I've been interested in the technology side for about since 2004, actually, watching different things being developed, so hardware as well as software, and I realized that if I wanted to get involved, which was intellectually very stimulating, I didn't really understand it. So I knew that I had to bring in younger people who would develop that side of the business.
So it's important for you to have the right management team around you.
Absolutely.
I mean, that's something I guess you take some time to build and find.
And it's difficult, and you go through different people because the team has to work well together. Everybody has to pull their weight. And I sometimes feel like I'm an orchestra leader.
I have no doubt.
Yeah.
So a little bit slightly lighter, but still very important topic: marketing. You have all this ability, there's all this knowledge, and you want to have the people going out to service your customers. How do you get the information out there? What did you first do when you bought this business?
Well, if you really want to know, that was the most difficult aspect for me. I didn't feel I could do marketing well. I'm not bad speaking one-to-one. I was not good at going out and making speeches. And I really didn't understand how to do marketing. I think it probably took me longer to build up the business because of that. I have used consultants over the years, but somehow
not necessarily successfully.
Not very successfully, no. And I think that one of the things that Daniel's brought to the company, and he's been with me now 18 months, starting 18 months ago on marketing, was really, first of all, getting me, getting the business, and able to translate it into not just marketing terms, but terms that, today's terms, people can understand and can understand the changes that we're going through.
Daniel, has there been a marketing medium that has worked better than others? Like what major strategy change did you, I guess, bring to the forefront when you came in?
One thing that I focused on at the beginning, as Danny said, was really defining the business and putting it into terms that are structured. So taking a lot of great thinking and putting it into a format that we can communicate through a variety of mediums. So face-to-face, online, and other mass media channels. So
it was more the content you worked on versus how you get it to people?
At the beginning, it was an exercise in content, which we're still actually going through. So just one example of that, it took us probably 6 to 8 months to define just some very simple cards that we use to explain what it is that we do, iterating probably a couple hundred times, and then translating those into a format for online, and translating those into a presentation format that we could give in front of large audiences and in front of small audiences. So that was the first step. And the second step was to define an actual channel strategy. So we started doing presentations. We got involved with a group called Hacking Health, which is a gathering of technologists, healthcare professionals, and people in business who are in healthcare, talk about how to deploy technology and solve problems. So presenting at those types of events, and then actually converting it into, for example, pay-per-click campaigns online or display advertising, those types of things, to actually define what is successful and measurable. So
do you keep tabs on your competition?
Yes. So it's interesting because we are, as I mentioned earlier on, in 3 businesses: in the home care business, corporate health, and in technology. So in the home care business, we watch what they're doing online, we watch their price points, we watch their marketing material, we make sure we have differentiated wording to really explain how we're different from a case management perspective and from the way that we train our people and the way that we deploy technology. So always trying to tweak the wording that we use and the channels. And then on the corporate side, it's a completely different exercise. That's mapping who is the buyer. Is it an insurer? Is it an employee assistance program? Is it an employer directly?
So it's really it's a whole detailed analysis that you try to really follow.
Yeah, it's an analysis on the content first, then on the channel, and then on the actual tactics to communicate to the channels.
You had mentioned before, Danny, that you had first used outside consultant and it didn't really click. And I'm going to ask maybe a dangerous question for myself, but have outside consultants really helped you out through your business, through your career? Have you had positive or negative feelings with outside consultants?
Not very positive, to be honest with you. I've had people come to me and say they're the best. Very often I think consultants.
You can say it. Go ahead.
They're full of it. It's okay.
No, but there are people.
I'm not one right now. It's all good.
There are people who are part of the core team in the business who are consultants. That's the thing.
I know. Yeah, I know. You came as a consultant, so
no,
look.
I don't even mean. Yeah, I'm one, but there are others.
Well, you used to be one.
No. I think it's very hard. I think to really promote a business, you've got to understand it, but to understand it, you've got to be in it. You've got to see it, and that's a lot of consultants come in and they they have their point of view, which can be very legitimate, but they don't really get what we, in my case, they didn't get what we do, and that was the problem.
And the last question I'll ask, just for as we try to get some short answer before the next break, is technology has a huge effect on your business, I'm sure, over the years. What's the latest thing that you felt was truly important to take your business to the next level?
It's about using technology at the point of care to make the experience for the patient, for the healthcare provider, and for the business better. So that goes for the home care business, it goes for the corporate health business, and it's figuring out for the specific case we're talking about, is it a video conferencing system? Is it a remote monitoring system? Is it an algorithm to figure out your mood? Is it a survey? Whatever it is. And so what we're doing is taking the same approach we take to care to the implementation of technology, which is customizing it for this specific individual and situation. And that we feel is going to help us scale as we move into a different world, if you will, larger patient populations and larger opportunities.
And I think, Dan, we find and we hear that most entrepreneurs, and when Daniel's talking about scaling, it's using that technology really to your benefit, seeing how you can take everything you've built and all the content and knowledge and trying to make sure that the technology can really help that business grow. And not everybody can get the right grasp of it, but when you can, it's absolutely amazing.
And we will talk more about technology after the break with our IT specialist. 7:49 on Today's Entrepreneur. Welcome back. And joining us this evening, Danny Pollock and Danielle Martz of Equinoxe LifeCare. And we'll also talk technology with Kevin Ammerman, IT specialist with Floor Landau. Welcome back, Kevin.
Thank you.
And Josh talking about IT, especially in healthcare.
And not only that, but how to, we were talking about technology and getting to your customers is, you have this product, you have this availability to get this information out there, but how readily accessible is it? And I guess, and it's a big word that probably has a lot of meaning, but Kev, talk to us a little bit about accessibility of, apps, software, logging in, all that jazz.
Well, when people say accessibility in the context of computers, usually they immediately think of things like screen zoom to make it a little easier for those that are a little bit with difficult vision, or audio prompts or things like this. But when you really think about it, it comes down to every single person that's using a computer or a web page or any piece of technology. And the accessibility behind it is how easily it can be approached and used. And it gets forgotten along the way in all too many cases. So even some of the most popular websites in the world, you take a look at them and you got to wonder how they expect people to use them. There's just so much information coming at people, and it's so complex and confusing. And especially if you add in some sort of physical disability or a vision problem, you got to wonder how people are actually able to use these services. And this is where accessibility gets lost along the way.
How do you overcome it? And can you give us an example of what works or what's difficult to achieve in somebody that, or a way that people got around it?
Well, two of the most well-known examples, if you compare, say, the Amazon webpage versus the Google homepage. Google is stark. There's only one single bar, and the cursor is there. It's waiting for you to type something, or in these days even just say something, and it'll fill in the blanks for you. Whereas if you look over at Amazon, you'll see there's probably 500 or 600 links just on the front page alone, and it's literally a sea of information. So you've got to kind of wade through it and hope for the best. And honestly, if you are suffering from motion impairments or anything like this, I don't know how it would be used. It's quite a challenge.
Daniel, for accessibility, when you're thinking technology out to your customers, are you thinking for them how easy can they access the information?
100%. So one example of that is we have a technology called Video Care, where it's basically what we call a skin over commercially available technology, like Skype, Vimeo for videos, Pandora for radio, and we actually configure it so it can be accessed by someone with a disability. So instead of having to wade through a massive information and find that button, it's a huge button that has a picture. They can click on that picture, and then if they want to access our nurse or our other healthcare professionals, there's a picture of that healthcare professional. They can click it once, make a video call or a voice call, instead of having to log in, figure out where they are in their list of contacts, on down the line in terms of the things that you actually take for granted as someone who's able-bodied and interacting with technology. So these are the things that we're thinking about almost on a daily basis as we develop the solutions for that population.
Is it easy? Is the technology today, Kevin? I mean, finding the ability or to make things a lot more accessible. Is that easier to do today than it was 5 years ago?
100% yes. So tools such as voice search and other like alternative input methods. So finding ways to stop using a mouse and find other ways to communicate with the computer, whether it be by voice or even eye tracking or something like this. It's making it a lot easier for a lot of people to get access to these systems. So the new voice-based search and navigation tools that are becoming so popular now and are even built into cell phones, it's making it a lot easier for a lot of people.
And you bring up cell phones, you bring up smartphones, and I think when we come back from the break, maybe a little bit of accessibility as far as smartphones are concerned, as everybody is using those devices, obviously more and more, to gain access to many different areas.
As well as Danny and Daniel's one piece of advice for today's entrepreneur. That's next. Remaining moments of today's entrepreneur with our guests Danny Pollock and Daniel Martz of Equinoxe LifeCare. We're talking about healthcare in your home, as well as Kevin Ammerman, IT specialist with Fuller Landau, and how about taking that technology into one's home.
And we were ending off, we're talking about accessibility, of course, with computers, but smartphones, are, of course, out there everywhere, every day, and people are using these devices all the time. Maybe you can talk to us a little bit about accessibility and smartphones.
Well, the smartphone that everybody loves to hate, the BlackBerry, the infamous BlackBerry, it probably has that one differentiator in terms of accessibility that everybody's looking for, and that's the keyboard, right? So, as much as we're worried that we're seeing the decline of BlackBerry, they do sort of have the edge in that market, and we're hoping that something can sort of step up to fill that gap. Because a lot of people, again, as pretty as the touch screens are, they just don't feel the same way, and they don't respond the same way when people are trying to type on them. So that can lead to trouble and people moving away from them.
And of course, there's screen size. I mean, you were in your Google versus Amazon example. If Google has one line that you type in, and Amazon is sitting with 500 things, how do people have to be very aware of their sites or their giving accessibility to different types of hardware? People
have to be aware that the view that they're getting on a mobile device is very filtered. They're not seeing the same thing that they might be seeing on a real computer, a proper computer. The companies that are producing these websites are very aware that they have a very small amount of real estate available, and they're trying to really focus that view. And while they may be looking at it from a marketing or usability perspective, what you got to keep in mind what information you're losing by using that smaller screen.
So it's more of a design? Is it a front of the picture, a design image in front, or is it a back end?
Well, it can be either competing or complementary. So in a lot of cases, unfortunately, design trumps out, and it's the look of that mobile site or even the full-size site that wins out over that accessibility factor. When things really work well together, they work hand in hand, and the accessibility is a part of the design, and it's planned in there.
Is that something you keep in mind, when you're talking about the look of your website and the accessibility, Daniel?
100%. So we have probably 30% of the traffic to our site comes through mobile platforms. So we make a specific effort to figure out exactly how it's going to render on different screen sizes so that we can present the best information depending on the size of the screen. It's critical. If you don't take that into account, you can lose eyeballs and you lose traffic and then you lose business.
No, clearly an important concept, and accessibility is absolutely huge when you're talking about getting to your customer online. Thanks very much for the thought, and as we approach our last minute or last 90 seconds, we'll turn to Danny and Daniel and ask you, what one piece of advice would you give to today's entrepreneur?
Despite all the obstacles, don't give up.
Short, sweet, to the point. At least you didn't bring out that business plan thing again.
I would say follow your passion and don't be afraid to wade into areas that are outside of your comfort zone. I think that keeps a lot of people away from entrepreneurship, and I would tell them not to let them keep it away.
And I would add, certainly my takeaway in listening to a lot of the stories and examples that you give, certainly from Danny's standpoint, is go with your gut. You know your business. You know your product and service. The entrepreneur knows it better than anybody else around them, consultants included.
But now we have a business plan.
But now you have a business plan.
There you go.
So your gut is hugely important. It's okay to vet your feelings and your thoughts with somebody else, but your gut is huge when running your own business. And I think that's the takeaway that entrepreneurs really have to pay attention to, is your gut can be right. It's okay.
Thanks, Josh, and thanks to our guests, Danny Pollock and Daniel Martz of Equinoxe LifeCare, Kevin Ammerman on the IT beat for Flo Landau. Thanks very much, everyone. And Josh, we'll see you 2 weeks from now on Monday at 7 p.m. for Today's Entrepreneur. The Exchange is next on CJ80.